Nivolumab versus Docetaxel in advanced non-squamous non-small cell lung cancer. Nivolumab is a monoclonal antibody that binds to the PD-1 receptor and blocks interaction with its ligands, PD-L1 and PD-L2. This bind raises PD-1 pathway mediated immune response against tumor cells. Blocking PD-1 activity results in decreased tumor growth in syngeneic mouse tumor models. Tumor recognition followed by mechanisms of action. Tumor recognition followed by tumor antigen presentation to T cells and T cell activation leads to tumor cell kill. T cell mediated immune response is modulated by stimulatory and inhibitory signals. Checkpoint molecules include cytotoxic T lymphocyte antigen 4, T cell immunoglobulin, and mucin domain 3 containing molecule. These immune checkpoints exist in a normal physiological state to protect against autoimmunity and inflammation. In a neoplastic state, dysfunction of these immune checkpoint proteins can lead to a tumor tolerance and eventually allow for tumor escape from the immune system. Targeting the molecules that regulate the immune response using antibodies has been the subject of much research and has yielded some promising and exciting results. Continuum of mechanisms of action, PD-1 receptor is expressed on several cells, including CD4 and CD8 lymphocytes, B lymphocytes, natural killer cells, and T regulatory cells. Ligands of PD-1 include PD-L1 and PD-L2. PD-L1 is expressed in T cells and B cells, dendritic cells, and macrophages. It is regulated in a range of solid tumors, including NSCLC. PD-L1 is located in the cell membrane and or the cytoplasm and is expressed in about 20 to 65% of NSCLC. The overexpression of PD-L1 in resect NSCLC is associated with a poor prognostication. Adverse reaction of Nivolumab has serious adverse reaction and common adverse reaction. In serious adverse reaction reported in the major of 2% of patients were pneumonia, pulmonary embolisms, dyspnea, and pleural effusion and respiratory failure. In contrast, in common adverse reaction were fatigue, musculoskeletal pain, cough, and decreased appetite and constipation. And in Docetaxel belongs to a class of chemoractic drugs called plant alkaloids. Plant alkaloids are made from the periwinkle plant. The taxanas are made from the bark of the Pacific yew tree. The vine alkaloids and taxanas are also known as antimicrobial agents. Mechanics of action of Docetaxel is an antineoplastic agent that acts by disrupting the microtubular network in cells that is essential for mitotic and interface cellular functions. Docetaxel binds to the free tubulin and promotes the assembly of tubulin into stable microtubulus while simultaneously inhibiting their disassembly. This leads to the production of microtubule bundles without normal function and to the stabilization of microtubulus, which results in an inhibition of mitosis in cells. Docetaxel binds to the microtubules does not alter a number of protofilaments in the bound microtubules. Common side effects of Docetaxel includes side reaction, nausea, vomiting, diarrhea, constipation, loss of appetite, feeling weak or tired, muscular pain, missed menstrual periods, temporary hair loss, or toenail change. In the phase 3 Checkmate 057 trial, the primary cell death protein 1 inhibitor Nivolumab improves overall survival versus Docetaxel in patients with advanced Nonsquamous non-small cell lung cancer. Showed survival improvement with Nivolumab versus Docetaxel in advanced Nonsquamous. Results checkmate 057. Median OS was 12.2 months for Nivolumab and 9.4 months for Docetaxel. The median duration for response was 77 months in the OPD IVO arm and 6 months in the Docetaxel arm. Median PFS with Nivolumab was 2.3 months versus 4.4 months versus 4.2 months with Docetaxel.